Chapter 8 is about medication for mental disorders. We've already talked about some of these as we went through and talked about some of our stimulants and some of our depressants, but this really is specific to those medications. Make sure you know when we're talking about diagnosing and giving medicine for mental disorders. It mentions the DSM. Remember, that's the Diagnostic and Statistical Manual of Mental Disorders. We're on DSM-5. If you've ever had a psychology class, you know that that's where we actually diagnose from. It's basically got all the disorders, and it's kind of like a checklist, and it'll say something like, to be diagnosed with clinical depression, you have to exhibit so many of these behaviors, and usually for a certain amount of time. One of the big things that we talk about, and I've kind of mentioned this before, is it has to affect their daily life usually, whether that's keeping a job, social relationships, family, any of that kind of stuff. That's when we usually start to diagnose these things. It also mentions in the beginning some of your basic ones that we look at, especially when we're talking about medication. Anxiety disorders is going to be huge. We've mentioned that. Depression. They talk about psychosis, which is a break from reality. You'll see in there schizophrenia, which is kind of a shattering of the mind. If you've ever seen A Beautiful Mind with Russell Crowe, it's a true story based on Professor Nash, who is a famous professor who had schizophrenia. He actually recently died in the last few years in a car accident with his wife. But it shows you exactly what he was going through. He had hallucinations, delusions, went on medicine, actually ended up taking himself off the medicine, and had to deal with like the side effects of schizophrenia. So you'll see a little bit in there about schizophrenia. There's a chart on page 168 from the DSM, or a box from the DSM that mentions some other ones. You've got agoraphobia in there, which is fear or anxiety of being in social environments like public transportation, going to a movie theater, something like that. You've got panic disorders labeled there, some of your anxiety disorders. There's a little box that shows you the diagnosis of schizophrenia or a portion of that. So all these are kind of mentioned in there, and we use drugs quite often to medicate people who have these disorders. Specific disorders, sometimes it's the only thing we can really use. A lot of disorders, we basically say the medicine, it's not curing anybody. All it's doing is helping the symptoms. So especially things like depression, bipolar, some things that there are maybe some chemical issues going on within that person, but a lot of times it's something, there's something emotional that is either causing the chemical imbalance or that is actually causing the depression. And if the person doesn't address that, they're never going to get better. So they could take medicine for the rest of their life, and it's not going to fix them. So we preach about therapy. Anybody who has any type of disorder, therapy is going to be your biggest option. You also have, we've started to look at more lifestyle changes like eating healthy, healthy diet, exercise, things like that can maybe also help with some of these issues. Something important to remember too when we talk about diagnosing and prescribing, remember that there's different levels of people who work in the field of psychology. So you have a psychiatrist who is actually a medical doctor who actually goes to medical school, takes medical classes. They are the ones that are able to prescribe medicine. When you see someone that's just a psychologist, a lot of times they do have a PhD, but it's not a medical PhD. So a lot of times if they are not considered a psychiatrist, they are not able to prescribe medicine. Therapists, counselors, things like that, a lot of times they cannot prescribe any medicine, but those are people that you can go and talk to and try to work through therapy with. There's a little blurb about trying to cure mental illness with drugs in one of the boxes, so you can read through that. But like I said, there's a lot of controversy about it because a lot of people, um, if there is chemical imbalance, yes, the medicine is going to help that. If that's the only issue, then yes, it's going to fix it, but you're still going to have to take that medicine forever. If there's something else causing the problem that can be addressed emotionally, then that that's where you're going to need your therapy or one of the other things we talked about, exercise, diet. What we end up finding out is things in our diet and can actually produce some of these or increase some of these levels of things like dopamine or serotonin as well. And so sometimes things like obesity or something like that can also have an effect and maybe cause or perpetuate some of these disorders. So that's as we move into the future, that's we're looking a lot more at things like how does our physical activity, how does our diet affect those things. Um, you have a lot of drugs that they talk about in here, and a lot of them are not going to seem familiar because it starts way back. So it starts back talking before 1950, and you've got things like what they talk about narcosis therapy. If people had a lot of money, where basically they could induce sleep for a week or more. Um, they talk about electroconvulsive therapy. It's important that you remember that because we do actually still use it a little bit, but not near as much as we used to. We used to use that quite often. It's like an electrical shock therapy. And it's it's pretty invasive, so they try not to use it as much anymore. But for someone who's suffering severe depression and the medication is not working, they will still actually use that some. They get into your antipsychotics, and it's a lot of terminology. My suggestion to you is make sure you understand um, the big groups and kind of when they were popular and kind of what they were used to treat. Um, but you're not necessarily going to have to know like there's charts in here that give you a bunch of different names of drugs. You're not going to have to know those. The major ones, the ones that we say, okay, this one sold the most or this one is prescribed the most, you're going to want to make sure you make a special note of those. You have some neuroleptics, which are a general term for antipsychotic drugs. Um, we also have drugs, we name them antipsychotics. You have phenothiazines, which are to treat psychosis also. And then it gets into things like that, some of the different types of things that they had going on, some of that not normal or a little bit different. They say it's atypical antipsychotic drugs. They mentioned one that's something that produces pseudo-Parkinsonism. So basically, it gives the person the symptoms of Parkinson's. So a lot of times tremors, rigidities, things like that. If you've ever seen, there's a there's a lot of different movies that depict some of these, and there's a movie that Robin Williams is in, and it's What Dreams May Come, I believe is the name, and basically it talks about, no, that's not the name of it. It is, I'll try to remember and like shoot an email out to you guys or something, but it shows people who are in a catatonic state, and oh, it's called Awakenings, and they basically, it's when they introduced L-Dopa and it started to bring these people out of their comas and they were living for the first time. I mean, these people were completely catatonic and now they're dancing and talking and having a great time. And then what they started to notice is they were starting to fall back into the catatonic state slowly. But that was really when that research kind of started with L-Dopa, which is one of the dopamine type medicines that we talk about. They talk about some side effects. It's called agranulocytosis. That's a low white blood count. Um, they talk about tardive dyskinesia, which is again kind of like abnormal movements, maybe some type of repetitive movements, rhythmic movements, sticking your tongue in and out, movements of the arms, things like that. So those are some of the things that that people were dealing with as well. Long term, again, like we said, a lot of these things, they're not fixing the person, but they'll treat the symptoms. A lot of times their situation is still going to deteriorate. It's not making it better, or sometimes it won't even keep it from getting worse, depending on what the issue is that they're trying to treat. Um, it says this one, they do give you one where it talks about schizophrenia, and they followed 1,400 patients. They were taking 4 different antipsychotics. Um, and one conventional for up to 18 months. Basically says about 3/4 of the patients quit taking that medicine before they even reach the 18-month, and that's very common. A lot of times people stop taking their medication. If you look at, like I said, if you watch any of Beautiful Mind, you see that he stops taking his medication because a lot of these medications have really bad side effects, and they're side effects that um, some people can't deal with. For him, he was very comatose. He was a mathematician, so he wasn't able to do math and to um, solve problems and do the things that he wanted to do. Another big one is he wasn't. A lot of these decrease your sexual arousal, and he wasn't able to have sex with his wife, or wasn't interested in having sex with his wife. There's a lot of little things that these things cause, and people don't want to deal with those side effects. So that's also kind of interesting. Um, they said there was no evidence really that the atypical drugs worked any differently than the typical drugs or any better than the conventional drugs. Um, you get into then kind of the different categories for antidepressants. Those are going to be one of the more popular that we prescribe. We also another more popular is anti-anxiety, and some of those cross over a little bit. But you want to make sure you know you've got monoamine oxidase, which is a type of antidepressant. Um, Cyclics, you might have heard some of those a little bit more common, and there's a list of them. And like I said, some of them are going to stand out to you, some of them are. Mostly what you guys have probably heard of is SSRIs, and SSRIs deal with our serotonin. It's called a selective serotonin reuptake inhibitor, and basically deals with correcting the amounts of serotonin in our brain, and that's passing through our synapses. And um, we those are probably the most common ones. Things like Celexa, Prozac. A lot of people have heard of Prozac, Zoloft, Paxil, and those are a lot of the commercials that you see on TV right now too. Um, there are some. Well, Buterin is pretty common, and that kind of falls into another category. But I would say probably SSRIs are the ones that you are most familiar with. Um, and like I said, Prozac was kind of the first one that we really talk about, and that was in 1987, so it's been around a while now. Antidepressants, they basically said around 2003, our sales exceeded about 15 billion. Um, declined a little bit 2004, 2005. 2012, still less than it was in 2003. So even if it increased a little bit, it was still lower than 2003. And like I said, a lot of that we think is because there's more and more different types of drugs, and we have things considered anti-anxiety. A lot of people are getting prescribed anti-anxiety. Um, for anti-anxiety, we have a lot of younger people getting diagnosed with with anxiety and getting put on medication. I had a lot of high school students that had passes where they could just leave the classroom because of their anxiety and were on medication. College students as well. Um, there's a lot you can argue a lot about that, and that would be something you would talk about in a psych class. But why is that happening? Why are we having so much anxiety as young people? Is it the way that we're raising people? Are we raising people to not be able to handle difficult situations, and that's what's causing the anxiety? Is it just being diagnosed more? What's kind of going on there? So that's a whole nother ball game, but it's pretty interesting that we are prescribing so much anti-anxiety medicine, especially for younger people. Talked a little bit about mood stabilizer. Lithium was a big um, that help treat mania and bipolar. And I think I mentioned bipolar earlier, but remember that's where you have very manic episodes, meaning very high, people who are impulsive, people who make quick decisions, very happy, very energetic, versus then you have your depressive states where you don't want to get out of bed, there's no feeling, you're sad, you're depressed. And bipolar, a lot of times they float back and forth between those. So lithium was one of the first things that they used to help treat that. If you look on page 180, there's kind of a chart that shows you number of patients in psychiatric hospitals. And something to keep in mind about that is we've actually closed a lot of psychiatric hospitals. That happened probably in like the 60s. And what you end up seeing now, and this is a huge, huge issue, and again, we're not going to get too much into it in here because that's not really what our focus is, but a lot of the homeless population are mentally ill because when all those mental facilities closed, those people didn't have anywhere to go, and most of them became homeless. And so that's why there's such a high population of mentally ill homeless people. And you got to think too, those people probably don't have access to the medicines that we're prescribing and giving to people who can go see a therapist. So that's kind of another interesting side point. But you can look at that chart and see how many people now we have in federal or non-federal, sorry, psychiatric hospitals. And that kind of gives you the basics of the using medicine for mental disorders.